Hello guys, I hope you're doing well. All right. Okay, just a sec. Let me set my camera. Uh, mhm. Right, guys. Hope you're doing well. Just doing this Instagram and YouTube live. If you've got any queries regarding PLAB2, first of all, congratulations those who got your results for PLAB1 recently. Congratulations. And yes, people are joining. And if you've got any query regarding PLAB2, any question regarding PLAB2, or for example, if you have got any question regarding the academy, the course, you can ask and I'll be more than happy to answer. So it's mainly a Q&A session. Right, we're doing well. What about you and your family? Thank you, doctor. We are doing good as well. Thank you. Right, yes. A lot of people have joined. Okay. Right. And keep putting your questions as well. So we'll take your questions side by side. Right. Okay, I think the most common questions, to be honest, I would say like nowadays candidates have got is the UKMLA. I mean, what's gonna happen once PLAB2 will be replaced by UKMLA? I just want to know, do you guys also have the same question? Hello, sir. Good afternoon from India. Yes. Good afternoon. Right. Okay. Dr. Janvi has joined, Dr. Navreet. Right. Hello, sir. Good afternoon from Pakistan. Hello, good afternoon, doctor. Mhm. Right. Okay. Yes. Hi, Ramita. Hi, Jellyfish. Hello. Right. So regarding this question, PLAB2 or UKMLA, I would say just the name has changed, right? The name has changed. So what we have is initially we used to have PLAB. So PLAB1 and PLAB2. PLAB1 is your MCQ exam, and then PLAB2 is your OSCE exam. That was the thing, right? Now what they have done, they have just changed the exam name. That is MLA, right? MLA. And again, it's going to have two parts. That is AKT, that's your PLAB1, and then the second one, that is your CPSA, which is PLAB2. What has changed? I would say the name has changed. Nothing else has changed. Another thing that have changed is the UK graduates. They will also be giving this exam now, right? So they will be giving this exam now, and that's the only difference I would say GMC has made it. So you don't need to worry. You don't need to worry because the PLAB pattern have. I mean, it was changed a long time back. It was changed in September 2016, and since then you will see like a lot of new things they're bringing in the exam. So they're actually slowly they have come up to this thing. It's not like in just one day they will, or in 1 month they will change it to UKML straight away. No, they are doing it from last few years. They have made a lot of changes. If you see the PLAB before 2016, it was completely different, right? And now it is completely different. So they were preparing for this UKMLA, right? So that's what UKMLA is. So you don't need to worry about any changes in regards to this exam, right? So I've got some questions on YouTube as well. I'll just take those as well quickly. Do you need to learn telecommunication stations anymore? Yes, definitely. The teleconsultations will still be coming, right? So teleconsultations nowadays, if you see like 3 to 4 tele or video consultations, that's coming in the exam. So still it's gonna go ahead. No change in that. Can we do the recalls of the previous month? Of the exam, can we get the common topics from there? Right, so this session is actually doctor for the Q&A session, yes, if needed, and yes, definitely we can do another session on that as well. All right. So the room in Aspire building, do they have table and chair? If they don't, can't buy one. The thing is, in the room. I mean, I think we should be reading and practicing in the practice area. It's open 24 hours. So why you need it in your rooms, isn't it? The rooms are, I mean, of course, you go there and sleep, isn't it? So that's why what we have done is we have provided 24-hour access to the candidates in the building. So I think there should not be any problem, right? I'm a kind of remembering the scripts now. Will it affect my performance in the exam? See, nobody is telling you to uh, learn the script, right? It has been given to you just to give you an idea. But if you are reading it by heart and learning it by heart, I mean, it's gonna give you trouble in the exam, my friend. So that is not at all a good idea. Don't do that. Just read it once. I mean, not all the scripts. I mean, read the management part. That's what is required because management is what you have to tell the patient in the exam. You should know that. But rest history, who's gonna give it to you? The patient, isn't it? Patient has come to you. No, they are patient. Come on. So what do you have to do? You just have to ask them open questions and do a good consultation. And of course, in the end, the management that you should be knowing, that is what you should be doing. All right. So um, that's the main thing, right? So do not go with the scripts. You will be in trouble in the exam. You will be a parrot, not a doctor. And what they want a doctor, not a parrot. So be very, very, very careful, right? So read it once quickly, but practice it 10 times. That's the mantra. Okay. Don't read it. Don't read it. Just read, read, read. No. Staying in room. That's why I think you're asking for table and chair in your room. No, there should not be any table and chair because I don't want you to read too much. I want you to come downstairs and practice and practice and practice. So that is how you can actually pass this exam. All right. Aishwarya, hello, sir. Big fan. Thank you, Aishwarya. Thank you. Thank you. Right. Any questions here? Let's check the Instagram as well. Right. And if anybody wants to, for example, ask question, and when I come on the screen, I can, bring you here as well. That should be okay. If you would like to, let me know. Is it always necessary to ask ICE for every station? See, doctor, it is entirely up to you. But ICE is I always say it's your biggest friend. Idea, concern, expectation. So these three pillars, it's very, very important because, when patient comes to you, I mean, they have got problem for last few days. Yeah. So what happened is they might have checked it online already. So they might be having a bit of idea about that problem. So instead of telling them that we are suspecting you have got this, you can always ask, what do you think you have? Do you have any idea what's going on? Are you concerned about anything in particular? For example, you're doing a diagnosis of cancer. You have to break that it's very difficult. It's not that easy to give the diagnosis because it's going to be a big news for the patient, isn't it? So but if they have got cancer symptoms, what happens? They might have idea. So ask, do you have any idea? Then you can ask, are you concerned about anything in particular? So they might use the word cancer from their side. Doctor, I'm worried about cancer. So that's why it's important. So idea important, concern is important, expectation. See, you need to know what are the expectations of the patient from this consultation. Otherwise, you won't get enough marks, right? Sometimes you're doing a normal scenario and you've done the history, done the treatment. For example, you have a station on tension headache. The treatment for tension headache is just remove your tension, isn't it, and work on your lifestyle. So you did the history, you made the diagnosis, and you just finished the station and ended up having only 1 mark in the management. Why? Because you didn't fulfill the patient's expectation, because the expectation was what? Maybe a CT scan. So who knows that, right? So just be careful on these things. Do ice is your biggest friend. Anytime you're stuck in the station, do ice, 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 ice. Do it. Do we have an Aspire candidate meetup this summer? Uh, Blackpool Upsilon batch here. Of course, doctor, that's definitely we can arrange, Dr. Mania. Yes, definitely, definitely. We'll plan something like a meet for all the previous candidates which actually joined Aspire previously. Definitely, we'll definitely work on it. Will the exam nature change after UKMLA? As we said, doctor, nothing is going to change. Just the name has changed, so you don't need to worry. We have read the blueprint of UKMLA. There's nothing different that I could find. If you want to read it, you can, but I've read it for you, so you don't need to worry about it. Just concentrate what's happening. What the PLAB2 is going to be the same, and nothing has changed. Just the name. Only thing is now UK graduates, they will also be giving this exam. That is their exit exam. But the good thing is they won't be giving the exam with us in Manchester in Hardman Street or Hardman Square. They'll be doing the exam in their respective universities. So what has changed for us? Nothing. We'll be giving the exam same in those centers. So nothing, right? Finding difficult to finish it in 8 minutes. Good question. Okay. Right. Hello, sir. Seeing the script in Aspire notes is making me anxious. Advise me how to approach to these notes initially. The thing is, doctor, I want you to attend the live course. Then you will understand. I'll answer that. Okay. First thing is how to finish a station in 8 minutes. The thing is, who is a good doctor? A good doctor who asks less question and a doctor who gives less medication. That's a good doctor, right? So when you have to finish it in 8 minutes, what you have to do? So you don't have to ask every single question. First 1 2 minutes, first minute is a golden minute because patient is going to give you a lot of history. So make sure you take it properly, right? Once it's done, once you have got that history, then you will be able to make some differentials or maybe the diagnosis. So what you have to do, just ask associated symptoms to make your diagnosis. Once you have the diagnosis, you ruled out important killer differentials. Now, when it comes to past medical history, lifestyle history, social history, you don't have to ask everything. Whenever I teach, I say there are 20 questions in past medical, lifestyle, social history. You don't have to ask all 18 or 20 questions. What you have to do, just ask 4 or 5 important questions which are relevant to that particular patient. Ask those and just finish it off. So history can easily be done in 4 minutes, and then you'll be having 4 minutes for your management, and that's what you have to do, right? So when you practice, don't put 8 minutes timer, put 7 minutes timer. So in the exam, what's going to happen? Maybe you'll have an extra minute. I think that would be much better. So that's the plan. That's what you should be doing. All right. Hello, sir. The exam is in June. Can we guide? How can I go through the preparation? Okay. The thing is, see, what we have is we have lots of different courses. I mean, and it's in one package. I'll tell you. First of all, I would like to say we are the only academy doing in-person live course. Nobody else is doing in the market. All right. I'll be blunt or whatever you want to say. The thing is, a lot of people, what they're doing, hybrid course, combine it with the recorded course or something. No, we don't do that. What we do is in-person live course in the academy in Blackpool, right? So when you join the course, it's a package. So when you join the full PLAB2 course, what you get? Straight away, you'll get the access to the recorded videos. You'll get the access of the notes, right? In the application itself, right? Then you can choose the days you want to attend the live online course. Our online course is not recorded. Recorded course is separate. Online live course, all the courses which we're doing in person in the UK, they're live telecasted for our online users. All right, so that is our online live course. So what you can do is you can choose from the dates are mentioned on the website, choose which batch you want to attend live online. So you have got the access of recorded videos, you have got the access of the notes, and now what you do is attend one live online course when you are in your country, in Asian country, African, whichever country you're from. So attend it from there. All right. So in those 12 days, you'll be getting an idea what PLAB2 is, why you should not read the script, how script can be troublesome in the future, and how to better utilize the scripts actually, because that's what you have to do. So you'll get proper understanding. And then if you feel, okay, I know like a lot of you are working as well, and you may not be able to attend the whole 12 days in one go. Okay, so you're able to attend 6 days. That's fine. Next batch, attend it again. Ask us for the access. We'll give you the access again. And maybe the rest of the 6 classes which you missed last time, you can attend with the next batch. So you attended the whole course when you are in your country. Now what you do, 6 weeks or 4 to 6 weeks before, come to the UK. Come to the UK, and what's going to happen there? Then you can attend live in-person course. Again, I want you to attend the whole course. If you feel like, no, I'm okay with medicine, I want some more classes on counseling, so attend counseling. I want more classes on ethics, attend ethics. I want to attend SimMan, I want to attend prescription, I want to attend exam. Whichever class you want to attend, just go for it. So that is what you are supposed to do. And when you come here, you'll be getting the book from our side as well. And the new thing that we have launched these days, that is flashcard. So I think from today or maximum tomorrow, you'll be able to access the flashcard, revision flashcard, guys. Those are joined Aspire, so you will be able to access them in your Study Genie portal itself, right? So today we'll upload some, and tomorrow maximum will be uploaded on the system, on the Study Genie, and you can download it from there and read it. I hope it's helpful, and if there is any feedback, most welcome. Will be definitely consider and see what can be done when we launch the next part of flashcard. It's a beta version. Any mistake, forgive us and just let us know and how can be improved, right? So this is what we do. Moreover, mocks. People are saying Aspire mocks are not good. Okay, now attend once and then let me know. The thing is, what we have done is now 16 rooms, 16 examiners, and that's how the mocks will be conducted. You'll have the full experience that you'll have in the GMC. So you'll have the same experience in Aspire Academy as well. So come and attend the mock, and then you will enjoy it. And I've seen nowadays a lot of people, they're actually asking for extra mocks as well. So yes, we are trying our best to accommodate them, and they're enjoying it, because one mock 16 station, two mocks 32 station, three mock 48 stations. So if you're done with 4 5 mocks, you're done with around like 100 stations in the mock under with the specialist, with the instructor, isn't it? So what happens when it comes to the exam? You have done a lot of stations. I mean, I think maybe out of those 100 you'll get 10 stations, so it's going to be easy for you to pass, isn't it? So that's really, really, really important. Yeah. And in the course, what else we have after the course? We're not going to leave you like that, because I know what kind of people we have got. Some they will only study when we push them, right? So we do that as well. So we have got post course support session as well. So every day something is happening in the academy, in the morning, in the evening, even if the class is not going on. So every week there will be one Simban practice session, there will be prescription practice session, there will be examination teaching, there will be hands-on mannequin, there is spam session where we accommodate the candidates and they do self-mocks. 5 6 7 8 sessions are done in 1 week. It's post-course. Course is separate, and these are post-course sessions that are usually done in the academy. So there's a lot of things. We're not gonna leave you like that. So when you come here, you will have something to do. So you will be busy. That I can promise, right? You're a big help, Dr. Ankur. Thank you, doctor. Do we fail the station if we don't get the correct diagnosis and the management not complete, even if the diagnosis is correct? The thing is, doctor, there are three domains. You need to give importance to three domains. If you don't know the diagnosis, my understanding, I would say, do not give the diagnosis. Just be a bit vague. Like if you have got chest infection and you don't know it's TB, is it pneumonia, is it PCP, you don't know. Just say you have chest infection. Which one? I'm not sure. I have to investigate you further, and that's how you can deal with it. So your management won't be wrong as well, because management just give the generic, like you have chest pain, I'll give you something for that. You have got cough, I'll give you something for that. So that is something that you can do, and I'll do further investigation. Which further investigation you want to do, just name those. I think that should be fine, isn't it? Yeah. Okay. Ice early or later? Ice, where I should do ice? Wherever you want to do ice, doctor. Do it once, do it twice, do it 3 times. Doesn't matter, but please do it, right? Okay. Hello, sir. Seeing the script in Aspire. Okay, that's answered. This is my first exam read. Okay, so don't read everything in one go, doctor. Read a bit, read one system like cardiology, then practice that. Read respiratory, practice that. Read smoking cessation, practice that. Read alcohol cessation, practice that. That's what you should do. Don't read, come on, you're reading 1,000 pages. It has a limit, my friend. It won't fit here like that. Read a bit, practice. Read a bit, practice. That's what you should do, right? Should I join in person first or online first? My course is in September. So I would say first, what you can do is you can actually join. I mean, you have the access recorded course. That's number one. Number two, what you should be doing, you should do live online course wherever you are from. I mean, if you're in the UK, you can do in person, that's fine. But if you're not in the UK, I would say do live online course from your country. That would be the best approach, right? Just do that, and then 6 8 weeks come before your exam, and then attend the course in person in the UK. They suggest only doing online course ASAP, then attending in-person course 4 to 6 weeks from the exam date. That's what I'm saying. Yes, perfect. That's the thing. Yes, my team is saying that because this is what we have planned for all the candidates. So yes, attend online as soon as possible, so you'll understand how I should prepare for this exam. Because now some candidates asking me about the script. Should I read it, not read it? We will explain everything to you. How the station can go in the exam. We'll be practicing in the course, the 12 days course. What we don't teach much, we practice. That's because that is what's going to happen in the exam as well. And when you see the practice, when you do some, you see others doing, you'll understand how the station, how you have to prepare for that station. So that's why we advise the candidates to attend live online course as soon as possible. Right. Thanks for the flashcard. The taster one, the neuro were amazing. Okay, I'm glad to hear that, doctor. And as I said, others will be available today and maximum by tomorrow on the study genie itself. All right. Good. So it's understand correctly. We are eligible to attend the both online course, and after that come to the academy to brush up your. Of course, if you're joining our full PLAB2 course, you'll get recorded course, notes, live online course, in-person course, post-course support session, mocks, everything. Come on, it's everything in one package. I don't think so. Nobody else is doing that much. If there is anybody doing, let me know. We'll see. Yeah, because I know nobody's doing in-person course nowadays. This is the only academy, Aspire Academy, doing it nowadays. All right. And our course is not hybrid course. People say some days in person, some days recorded. No. 12 days you'll see me or Dr. Nikhil or other tutors. Mostly the course is done by me and Dr. Nikhil only, and we'll be doing it in person. You'll see us in person. It's not online, in person. We're talking about from the academy. The course is still going on. Today I was off, so Nikhil is taking class. So still it's the course is going on, right? So it's in person course, doctor. Right. Okay, I have selected the dates for the face-to-face course. How do I get access to the online course for the earlier date? The thing is, doctor, you can check that because the dates for online live course and in-person 12 days is the same because it's the live telecast of it. So just check the dates on the website, and if you want to attend any course before, I mean the live online, just email us at info@aspire2plab.com mentioning I would like to take part in this course, and you will get the access. So no problem at all. All right. Okay, so what's the difference between MLA mapping and the standard PLAB2? Will there be any change? See, doctor, if I have to market my course, I'll say there are a lot of changes. But I don't need to market my course because people know us, right? So the thing is, what's the difference? There is no difference. The name has changed. Now UK graduate will also be giving this exam. All right, that's the change only. Nothing else has changed. Uh, PLAB2 will be called as a CPSA, PLAB1 will be called as AKT, and the exam instead of PLAB, it will be called as MLA. That's it. Right. Please help us with the eye specialist referral. Do we refer the patients with blurry vision? Yes, doctor. If there's a blurry vision, you have to do one thing, doctor. On our recorded course, I have done 10 to 12 small eye videos explaining every single diagnosis, whether it is glaucoma, whether it is retinal detachment, whether it is ocular toxoplasmosis, whether it is giant cell arteritis, whether it is intraocular hypertension, blurring of vision, keratitis, or scleritis, everything I have explained in those 10-12 videos. When you need to do immediate referral, when it is normal referral, everything has been explained in a very much detailed way. So please check those videos in your recorded session. I think that would be helpful. Right. Okay, sir, is 9 week enough for the preparation? Yes, if you are coming only for PLAB2 preparation, then it's enough, right? But if you're doing a lot of other things with PLAB, then it might be tricky. Otherwise, 9 weeks, yes, doctor, it is enough, yes. Where can we get the latest management guidelines from? I wonder the scripts available updated or not. My friend, we do update. We do update. Everything is updated. You don't need to worry. However, if you want to read it a bit more in detail, you can definitely do that. Please follow number one, NICE CKS guidelines. Number two, NHS guidelines. Number three, patient.co.info. So these are the three websites I would say you should follow. Don't follow anything else. And we do copy paste from there itself. So definitely, I mean, it's updated, so you don't need to worry about that. Yeah. Can we take the online course earlier and then do it again near the exam and then attend academy as it mentioned 2 times? Yeah, of course, doctor, of course. See, and one thing I would say, this exam is not about attending the course again and again. This exam is about practicing as much as you can. Yes, you can do what you said, like can we take the online course earlier and then do it again? Of course, near the exam you can do it again as well. But I would advise to attend few classes in person as well. So that is also included. So yes, you can definitely do that, doctor. That is absolutely correct. Yeah. Uh, are your flashcards explained? Yeah, so flashcards. Yes, doctor. So, I mean, flashcard, the thing is, what we are now doing, another thing, interesting thing I'll tell you, gave us the feedback on that as well. So, we have made the flashcard. It's, I think, more than around 200 flashcard. We are making more as well, but we will launch these so that you can read it, and we are working on a few more as well. Now, what we are planning, we will be explaining those flashcards as well. So, flashcard, and I'm going to record a video and then going to give it to you in the Study Genie portal or on the YouTube. Would that be a good idea? Because we have done some, like for ophthalmology, for ENT, we have done that. You can check on the system. It's already uploaded for ophthalmology, for example. ENT will be uploading in a few days. So what we have done with those flashcards, keeping on the screen, recording it, the verbal thing as well, and then you will see, you will get it as a video. So you have the explanation with the flashcard. So I think it would be more interesting. That's what we felt. And we just want to know about your opinion as well. What do you think if we do that? Would that be interesting? Hello, Dr. Ankur. Just booked my exam for 24th of June, 5 days prior in the Is the time enough beginning from today? Yes, doctor. So you have April, you have May, and June. So 3 months roughly. I mean, you have got more than 10 weeks. You have got, so definitely it's enough time, doctor. Enough time. But make sure start from today. Yeah, you said you started from today. Yes, if you're starting it from today, then yes, you have got enough time. Yeah. Flashcard, we need to pay additional. Not really, doctor. No, just we will give you the coupon. I mean, you'll get the message from our side how you can access. So we'll give you a coupon and you just put it and you will get the free access in the Study Genie portal. You don't need to pay anything. It's just one package, right? Okay, where I can know the dates of the batch, doctor. So you can check on the website www.aspiretoplup.com, or even you can check on our Study Genie portal www.thestudygenie.com. If you open, you'll find the dates, right? Okay. Is a month in the academy would be enough for just the course in person? No, doctor. So if you're done live online course already, then you come to the academy. You have to come at least 4 to 6 weeks, and you do the course. And after the course, you need to stay for 3 4 weeks. Otherwise, it won't work. It's not like you attend the course and go back to your home. No, you have to stay in the academy for at least a month. Then only you will feel better prepared for the exam. Can we get recorded versions of your live classes? I mean, it's not why we don't give that. There is a reason behind. I'll tell you, because in the live courses, what we do practice. So a lot of candidates, they're not. I mean, what do you say? Not comfortable sharing their video. If I'm practicing with somebody, I don't have any problem in sharing my video, but the other candidates will have. That's why we are not sharing, because it's a practice thing. But as I said, recorded course, it's already available, so you can just have a look there. All right. My exam is on 23rd of October, and my session is booked for August. Can I do a mock in August next half, and second is in the week of October? You can do that, doctor. I mean, usually you can book your mocks on your own. We don't need to ask us, because this is how we have made our portal, right? But if you want to do a mock very much early, as you said, in August, just do one thing, email us at mocks@aspiretoplup.com, and we'll be able to help you out. You can definitely do that, yes. Any discount, group discount, WhatsApp link? Yes, yes. So yes, group discounts. There are a lot of discounts going on, guys. So the course price £649, right? So if you're a group of 5, you'll get a £100 off for everyone, right? And if you're a Plabable subscriber, you'll get £100 off. And again, the thing is, if you are a big group, 15 plus members, let us know. We can even give you a bit more discount. So it's around £150 per person. So the course you can avail is in around £500 only. So all the kinds of discounts going on, and the discount, this big discount, £150, won't be there for long, maximum 10 days, I think. And the result, it's already been, I think, a week now. So maybe maximum 1 week more, and then we will be closing this discount. So hurry up, guys, and don't delay it. Yeah. Okay, what else we have? My exam is on 20. Okay, that we have done. Hello, so my exam is on October 4th. Will I get the Access Study Genie account till my exam? In my enrollment, it says it will expire on July 27th. Okay, the thing is, doctor, you know what happened? Whenever we have to put the course in these portals, our Study Genie portal, for example, so we need to give them a timeline, and the timeline we have set is 4 months, right? So yes, if it is coming, I mean, if your exam is after 4 months, you don't need to worry about it. The thing is, before your subscription expire, as you said, it is going to expire in July according to your system. So 27 July it's going to expire. So do one thing, around 15th or 20th of July, just write an email to us that my exam is in October and my Study Genie access is going to expire on this day. Could you please give me the access till my exam date? And our admin will be able to do that. So you don't need to worry about it. All right. Okay. Do you have a SimMan course? Yes, our course, I mean, separate SimMan course, it's there on the, if you want to get only SimMan course, it's already available in the recorded session. If you want to buy that separately, I think it costs £50. You can just buy that and just see it. It's a recorded course. It's there. But in our 12 days course, obviously we do SimMan as well. We have got one dedicated day for SimMan only. Morning, 3 hours we teach, and then evening 3 4 5 hours we do practice with you guys. All the stations, whatever we have got, we do practice, so at least you will see what exactly is happening. All right. Okay, sir, followed all your YouTube explanation. Very nice. Very additional video. Can we, any additional videos can we expect? Of course, do one thing, doctor. I mean, we have A lot of videos are on the study genie. Everything is there on the study genie. We have not kept out, I mean, everything. Just only taster sessions we have shown it to you in on the YouTube, and also we have got Aspire course Lite as well. So there also we have uploaded many videos. But yeah, slowly we are putting a lot of things on YouTube. So definitely you will be able to access. We'll see next one, which video we're gonna put. Any particular video if you have got in your mind, Dr. Aishwarya, let us know. We can definitely do that. My name is Wahaz. Hello, Dr. Wahaz. Difference between PLAB2 and UKMLA? No difference, doctor. Name has changed. AKT from PLAB, I mean, PLAB1 has become AKT, PLAB2 has become CPSA, PLAB has become MLA. That's the difference, right? Okay, is 5 weeks between the last day of the course and the day of the exam is enough? Yeah, 5 weeks, yes. I mean, do one thing, but when you are in your country, just attend the live online course. So when you come here, attend the course in person, and then 5 weeks after that, definitely enough. Good idea, yes. Charges, etc. Sorry, I'm a newbie, so asking in here. Okay, no worries, doctor. So charges for the course, 649 pounds, Plabable subscriber, 100 pounds off, group of five. 100 pounds off each person, and a group of 15 plus 150 pounds off. Yeah. Okay, how many hours per day does one course day take? So we start at 10, doctor, and finish around 5 or 6. It depends on the day. Yeah, so 5 to 6 roughly. So, I mean, 1 hour break we usually have. So around like 6 hours classes daily in person, live. Right. How to avail the group discounts? You have to make a group, and what we can do is uh, we will put some WhatsApp link as well, maybe on the Instagram, on the Instagram. What do you say, on the description? Just go and just join those, and if there's any possibility, we'll be able to make help you in making a group as well. All right. Okay, that's how you can avail the group discount. Thank you, thank you. I'm afraid you got it wrong. I asked about the Aspire accommodation. Okay. Job said, okay. Right, so the accommodation, right? So if you booked our course, you can definitely book the accommodation as well. We have got four different kinds of accommodation, different kinds of room. And as the result was announced just recently, there are a lot of discount going on in accommodation as well. If you're booking it for more than 28 days, you'll get 6 days free of cost as well, right? So just raise your inquiries on our website, and we'll be able to tell you like which room is available and how you can get the discounts and all. All right. So I think that's your question, doctor, right? Charges are like the room starts from 18 pounds and it goes till 30 pounds. It depends what kind of room you want, right? So all the kinds of room you can check on the websites. Yeah. Yeah, charges, as I said, like 18 to 30 pounds roughly. So not related, but there's a job saturation in the NHS. This always happens, doctor. You will see 1 year, maybe like there's a bit of job saturation. But then things will improve. A lot of jobs for the junior doctor was taken by PAs, physician associates, and the specialist nurses. But there are a lot of protests going on. Hopefully, what's going to happen is they will be start recruiting more doctors soon. That's the thing, right? But again, those are not able to get the non-training job. A lot of them actually applying for directly training posts as well, and they're getting it. It's not like they're not. So, yeah. So go for it. That's what I can say. Yeah. All right. I'm coming there in May 1, and I'm attend the May offline course. Exam is on June 11th. I've started my preparation. I've attended the online course. Is my time enough? Right. So May offline exam is on June 11th. Hmm. Are you coming on May 1? That's fine. I mean, you have got 6 weeks in the UK, so I think, yeah, that's good time, doctor. I've heard good things from my friends, Anya, okay, Sabah, and the rest, hoping for the best to learn from you guys. Of course, Dr. Anya, Dr. Sabah, I know them, Dr. Anya, she's a famous YouTuber, I know her. So, yes, so definitely say hi to both of them from my side. All right. Right, and yes, so the coupons we will be sharing on the Instagram bio. So you'll get the WhatsApp link, the coupons and everything. We will share on the Instagram bio as well. So just stay in the Instagram. If you're not joined, not following us, please follow. Come on, guys, follow us. Yeah, so WhatsApp group link will be sharing it Instagram bio. So please, after this session, just go for the Instagram bio and you can just join the WhatsApp group. And there you will find a lot of people in your situation looking for a group. And then all of you can join together and make a group, right? Hoping for the best. Thank you, doctor. Thank you, doctor. My exam in September. Can we avail the of later as well as accommodation? I have subscribed full course. Doctor, the thing is, for accommodation offer also is gonna be for next week or 10 days max. So it's advisable you book it as soon as possible. Otherwise, you may not be able to have those offers, right? So go for it as soon as possible. Right. Is this advisable to have a mock 1 week before the exam? That's absolutely fine. We advise to take the mock 1 week, 2 weeks, or 3 weeks before the exam. So that is the timeline. So yes, definitely you can go for it. What's the best way to exam preparation? Have first of all enough time and attend. You get the extra recorded videos, see those, attend live online course, and then come to the UK 6 to 8 weeks before your exam. Attend in-person course, and then stay in the academy and join our all. Post-course support session, give them all, and go for the exam. Right, so that's the technique. Will we each personally get the flashcard when we come there in person? So you'll get the access in the Study Genie Doctor digital copy, right? Okay. Digital copy and you can download, and if you're not printed, you can print it from your side. So easy access, right? So because if you're in your country and why you should wait till you come to the UK to get the copy? So that's why we're making it available online, download, print, and I think you can read digitally as well. So that's it. Yeah. What advice you have for someone who can only attend in-person classes or mocks just 3 weeks before the exam? Okay, so what you do is, doctor, do at least our recorded course, right? So because when you come 3 weeks before even, it's not like you are very much fresh to PLAB or MLA. You should be knowing everything beforehand. Here you are coming or attending in-person course just to polish your skills, not to learn it. You have to learn it beforehand. So at least, I mean, if you don't have time and you're spending only 3-4 weeks in the UK, so what you can do is when you are in your country, so do recorded course, see the videos, examination videos. When you come here, you won't feel overwhelmed. That's the main thing. Yeah. For accommodation, do we need to pay the whole money upfront? No, we can make it in two parts as well. So you will pay half now, and then half can be paid maybe just 1 week or 10 days before your arrival time. So in the system, everything can be arranged. It's like that only. You will be able to pay it in like two parts. One now, just to secure your booking, and rest of it maybe a week or 2 weeks before your arrival date. Yeah. Okay, how many weeks of preparation is required for PLAB2, including offline and online? So you attend online course in your country, but I would say when you come here, I want you to have at least 6 to 8 weeks. 2 weeks for the course, 12 days, I mean, and then 4 to 6 weeks after the course. That would be the best time because a lot of things are there, and I want you to give one attempt wholeheartedly to pass this exam. All right. My exam is on 25th of June. I watched offline videos, some other academy in Crew and read the notes. Is it a good time to switch the academy, taking into consideration the time? Exam is in June. See, doctor, I'm not sure what did you see in those videos. If you like those videos, I would say go with that, isn't it? It's about, see, everybody is a doctor here, and I'm not sure, I haven't seen the videos that you're talking about, right? But if you're talking about the exam time, you have enough time. You have April is just starting, May and June, 3 months you have got. It is enough time, right? So you watched offline videos. So I mean, it's you who is gonna decide. Cannot be. I'll be biased. Obviously, I'll say Aspire is best, which is the truth. But if I'm saying it won't be nice, I think if my candidates will say, then only you will trust me. All right. So it's not a good idea for me to comment on your question here. I hope it makes sense. Right. Okay. Academies stay available. Yes, doctor. So the thing is, what we have is we have got the classroom basement. Ground floor is the practice area and the cafe. We have a small cafe as well. And then upstairs, fourth floor is the accommodation. So day, night, whenever you want to study, come on, come downstairs and practice. 24/7 academy practice area is open for Aspire House candidates. All right. I know, like doctors, some doctors want to read in the morning, some want to read in the evening, they want to practice in the night. You can do that, no problem at all. All right. Okay, what else we have got? Does the accommodation provide free Wi-Fi and paid meal service? We do have free Wi-Fi, that's correct. Yes, Wi-Fi is available, but the thing is the building is big, so there might be few areas, I mean, a tunnel, I mean, the where blind spot might be there, but yes, you have the access of the Wi-Fi and the meal service. The thing is, the cafe is there, so you can have biryani, you can have sandwiches, buckets, drinks like coffee, tea, and Coca-Cola. I mean, these things are available, so you can definitely get that from the academy, right? Okay. Is UKMLA expected to be very different? Notes will see a change. Nothing will be different, doctor. Nothing will be different, as I said. Are the recorded lectures and online course the same? No, no, no. Recorded is recorded. Online live course is a live telecast where we practice. It's completely different, doctor. Right? Uh, my exam is in August, so how do I start the preparation from the scratch? Join the course, see the recorded videos, join live online course as soon as possible, and then come 6 to 8 weeks before your exam to the UK and attend in person. That's the best way to do it. Yeah. Sir, I don't know how to cook. How will I manage my food in the Aspire house? You'll have your friends, they can cook for you. And in the UK, you'll get lots of pre-prepared meals from the supermarket, right? Frozen foods or pre-prepared meals, so that can be done. Also, we have got the cafes, as I said, the sandwiches, biryani, buckets. It's available, so maybe once in a while you can eat there as well. So that's the thing. And you're coming for a month or two, you don't need to cook. Come on. The time is to prepare for the exam, right? So don't worry about these things. You'll be able to manage. When to mail if you have to attend online, offline course after an online course. Just check the dates before the course starts. 2 3 days before the course starts. If you email, that should be fine, doctor. Okay. Uh, okay. So I think that is it. Do we have any more questions? And one thing, guys, I've seen like a lot of people say, I mean, the examination videos, I mean, they were struggling in the examination and all. One thing, have you checked our YouTube channel, the examination playlist? We have got every single examination and mannequin uploaded on our YouTube channel. There is nothing that is not there. If there is anything, let us know. We'll upload that as well. But in my understanding, every single thing is there. Please see it. And if you are coming here later, like say one month before your exam, so make sure you see those videos, maybe practice that examination on your family members and all. That is what you should do. So when you come here, you're fully prepared, kind of, right? 2 months enough for PLAB2? Yes, doctor, but start from today. 2 months enough. You can manage, yes. Okay, how can you find out the dates of the mock test only through booking it? Yes, you can book. See how you book your GMC, your PLAB2 exam. You will book your mock exam like that only, right? So you have to put your exam date. We will ask you in the form, and then in the Study Genie, our web application, you will be able to book your mock on your own. The dates will be shown to you. You just book it. And if you're not able to find the dates that some kind like you're looking for, email and we'll see what can be done, right? So you book your mock. We don't book your mock. Everything is automatic, doctor. Can we take the offline course twice as advertised? Of course. Once in September, once in October. No problem, doctor. More than welcome to attend that way. No problem. How tough is the exam these days? See, doctor, every exam is tough if not prepared well, and every exam is easy if you have prepared well. That's what I would say, right? So if you prepare well, it's not difficult. It's very easy exam to pass and very easy exam to fail. So make sure you have got proper guidance, then it should be okay. Yeah. Just out of curiosity, sir, how long does it usually take after PLAB to before landing a job in the NHS? It's different for different people, doctor. It's difficult for me to like say one word for this, isn't it? Some people, they got it in a couple of months. Some I know they're waiting for maybe 10, 11 months as well. So it depends. It depends. So after you pass PLAB 2, you need to work a bit more on your CV as well in terms like do ALS, do attachment, try finding the attachment, do poster presentation, make sure if you've got any publication, all those things you need to put in your CV. And if you have done that, then you'll have fair chances of getting a job. All right. Uh, okay. How many stations do you have in your mock? 16, doctor, because exam has 16, so we also have 16. Same. What is the cost to book extra mock? Right, so if you are Aspire candidate, right, so extra mock usually we say £75, but nowadays we have crashed the price. So Aspire candidates, if you want to book extra mock, you'll pay £60 only. And if you are a group of 5, then we can even consider a bit more, and we can give you in £50 as well, extra mock. 2 mocks are included with the course. If you want to get extra, £60. Right. Oh, doctor, which email address for request of access of online classes? info@aspire2plab.com. All right, doctor. Will Aspire be able to help us with attachments? Not really, doctor. No. Because attachment, you need to email the HR, you need to email the consultants, and they will be able to help you out. So it will be difficult for us to arrange an attachment for you. All right. I've just tried to book a mock included to my subscription. However, it doesn't show any date. Is it in person or with the any problem with the website? The thing is, doctor, you know what happened is, if you can tell me, Doctor Varvara, if you can tell me when is your exam? When is your exam? Because see, we are in April. So April, May dates we have opened. We haven't opened the dates for like July or August, because we will be opening 24 September your exam date, right? So the thing is, what we have done in our system, you will be able to see the dates only 3 weeks before your exam. So your exam is on 24 September. So roughly you'll be able to see the dates from beginning of September. But we have already opened the date for April, May, and some slots of June only we have opened. So we have not opened for July, August, and all. So don't worry, don't worry. Every like we go in like 2 months in advance we open. Otherwise, it might be a bit tricky, right? So don't worry. Before your exam, you will be having your mocks. Yeah. Great. Any other question, guys? Anything else? Yeah, I mean, I wasn't thinking that we will spend like roughly 45 minutes. I was thinking maybe a 15, 20 minute small session. But I think on the YouTube live, a lot of people joined. There were around 100 people joined on YouTube. Insta, yes, initially there was a bit more, but then, yeah, now it's only 15, 20 people. Okay, good, good. I think I bored you guys, huh? Right. Any other question? Any other question, guys? Or else we'll uh, close the session. All right, guys. So that is it from my side. Okay, does Aspire provide ALS course? We used to do actually with one of the training center in the UK, 2222 training center. We used to do it with them, but then it was a bit difficult, you know. So we now refer our candidates there only. So if you want to book it with them, you can just check their website, Doctor 2222 Training Center. They are based in Manchester, so we used to do with them. So if you'd like to book, you can book with them, or you can book with other providers as well. So we're not doing it anymore in our premises because it was a bit. Uh, Too much and then sometime our venue is not available because a lot of sessions that is going on live on in person mocks and all those things, so that's why we have stopped doing ALS now. Where we can get the detailed guide on accommodation, you can check on our website, doctor, www.ankhilaspirelettings.com, or else if you go on our website www.aspire2plub.com, there is a column for accommodation. Just go there and it will lead you to the proper website for our accommodation, and you can check it there. All right. uh, what if I want to take my first mock more than 4 weeks before the last date? You won't be able to book on your own, doctor. You can email us to mocks@aspire2plab.com and let us know about it, and we will be able to help you out with that as well. But you know, advisable thing is give the mock when you are a bit ready, isn't it? Otherwise, I don't want you to waste your mock, isn't it? But yes, it's not like you can't do it, but the system we have made it won't allow you, but you can email and manually it can be done from our side. So don't you worry about that. Yeah. If not PLAB, what else can I do? What do you mean, doctor? That is a bit vague question. If you can tell me a bit more in detail what your question actually mean. Uh, how to book the full course? Just go on the website, doctor, and book it. That's how you can book it, right? And straight away you'll get the access of the notes and the recorded videos in the application itself, and then you can decide on which dates you want to attend the in-person or live course. Yeah. Uh, okay. Sorry. right. All right, guys. So that is it from our side today, and we'll see you in these Insta or YouTube live again. I hope you enjoyed it, and I was able to answer your queries. If any more queries you have got, you can email us to info@aspiretoplup.com, and we'll be able to sort it out. And even if it is for accommodation or any mocks, and you can email there, and we can forward it to our respective teams, and they'll be able to get back to you in 1 to 2 days time max. All right. So do you provide coaching for PLAB1 as well if we are already in the UK? Yes, we do provide PLAB1 coaching. Our Plabable friends, Plabable is our friend. I mean, they are our partner in it. So you can join their, what do you say, the Q Bank. That is really good. You can do their gems as well. And before every course, they do 3 to 4 days session, which include a big mock as well. So do attend that. I think that would be enough for you to pass your PLAB1. They have got the very good website, very good resources they have got, right? So I think that should be enough. Yeah. Quick, sir, a quick advice for better performance in PLAB2. Hard work, hard work. Right, that's the thing. Because for doctor, if you're a hardworking doctor, you'll pass. Same thing here. There is a little bit different thing in PLAB2 because it's a bit of communication. It's medical knowledge plus communication. And sometimes the doctor from Asian, African countries, we might be lacking a bit in communication, and that's what we try to teach in PLAB2, right? So that's the thing. But if you're a hardworking person, you're able to give your time to this exam, you will pass. Respect the exam, exam will respect you. If you give 100%, you'll get 100% result. That's how it is. Yeah. So hard work and smart work as well. It's exam for a smart doctor. So you have to be smart. Like I have got less time, 1 minute left. I have a lot of things to say. I can't say everything. What I should say now to get that mark. So that presence of mind is really important as well. All right. Okay, guys. So yeah. Thank you. I think, yeah, no more questions on Instagram, no more questions on YouTube. Yeah, actually, I was on both the phones. I think sometimes you feel I'm not able to give eye contact because I'm just on both the devices. So that's why. Yeah. Okay, guys. Okay. One more question. If I book my accommodation for 7 weeks, will I get 6 weeks free? Huh? No, I mean, what we say is if you book for more than 28 days, you will get 6 days free. So if you're booking goes for 7 weeks, definitely you'll get 6 days free, doctor. Just email and yes. Do you guys have an app? Yes, we have got application. We have got a web application. We have got Android application. iOS application is still in process. It's giving us a bit of trouble. But yes, if you are Android guy, yes, we have the application. Or else you can check it in the web application. That is what we have got. Yeah. All right, and if you got any query, we're gonna put our WhatsApp link in the Instagram bio. Please join the WhatsApp group, and you can ask your query in the WhatsApp group as well. Our staff admins, we are there. I'm there as well, and we'll be able to answer your queries there, and we can put you in contact with the relevant department, whether it is accommodation, the mocks, the course, whichever, whatever question you have got. So we'll be able to help you out in that way. All right. Okay then, guys, we'll check for the link. Yes, doctor. Link will be shared soon. All right, guys. Thank you. Thank you. I hope you enjoyed it. And have a nice evening and enjoy the rest of your day. Thank you. Bye-bye. All right, guys. Thank you. Bye-bye. Okay, this was my last question. Yes, doctor, tell me. Accommodation booking via website, app, or email. So the thing is, you have to check the website first. You need to see which room you like. Which room you like. So you have to request us that I want to book this room from this date to this date. And our admin will get back to you within 24 hours to see if there is an availability, and if there is an availability, they will send you the payment link as well, so you can make the payment and secure your room. You don't have to pay everything in one go. You'll paying roughly half of it, and then the rest you can pay before a few days before your arrival as well. So you have to request it from the website. All right, everything is automated. Yeah. All right, Dr. Datta. Thank you. Any other question? Anyone? All right. That's great. Okay, and yeah, thank